working with transgender patients, I think, for many reasons that Stef outlines in their book, be it that there aren't necessarily clear-cut guidelines and or evidence, or there's just a lot of art in this medicine, as we sometimes say, and that it is very much kind of having to center some of that patient's autonomy at the expense of some of our paternalism, our own perception of our expertise or what we may know and where we sort of fall on that hierarchy, where you really have to kind of give some of that up and say the expert in the room here is actually the patient, because we're talking about their own identity, be it their gender, and what their goals are and what they need. When we have evidence-based medicine that then translates into practice guidelines around something like high blood pressure, we could all sort of, say like, okay, so the evidence shows that we need to get blood pressure to, certain numbers, and then we're going to have different organizations kind of throw out what those numbers are based on their interpretation of the data. And it's, 140 over 90 or 130 over 80 or 120 over 80, depending on who you ask. But that's pretty clear cut. And there's, of course, nuances around that based on age and based on fall risk and so some of these other things. But it is very different. And we're not going to have 100 answers if we ask 100 patients. And yet, when we're talking about treating someone's gender, we very much could have 100 answers when we're thinking about that. So I do think that the lack of evidence-based medicine and then the lack of practice guidelines that are based on good evidence is one of the things that is a barrier for providers' comfort level in treating trans patients. When we're talking about risks, we're absolutely talking about some things that are really unknown. So when I'm meeting with a patient and for the first time kind of talking with them about going on medication, and when I have my PharmD, my pharmacist, review with them the risks and the benefits of, let's say, testosterone therapy if they're looking to masculinize and if they identify somehow as sort of transmasculine, then we're for sure going to talk about the potential risks and things that we don't have great evidence for. Because to Steph's point, we don't have, this is all of the papers that have studied transgender men on testosterone at this dose for 50 years. This is the percentage that get heart disease or that had strokes. We don't have that data. So we extrapolate and use a lot of data from, let's say, cisgender men who are taking testosterone for low testosterone levels. So we do feel like we know what the hormone does, but we can't necessarily say that we know what it does for transgender masculine people. But so we will talk about what are the potential risks of being on testosterone. We talk about any sort of change with their cholesterol levels, a potential increase of things like diabetes or heart disease or sleep apnea or whatever that it might be.